called Mark Lyons, our attorney, about who will conduct it, and it does go upon the secretary to conduct this meeting if the chair and the vice chair are not here. It looks like we do have Jessica Jameson, our third board member, still lacks the quorum that is needed. So it is my suggestion, and I'd like to hear from the three board members in attendance of their desires, but it would be my suggestion that we move all of this to our April 25th board meeting, and so that we can get all of our board members here. There is nothing here that's necessarily time sensitive, but anyway, that's my suggestion that I'm going to throw out. And Dr. Johnson, Dr. Fletcher, Dr. Jameson, I'd like to hear from all of you of if you're agreeing with that or if you have another option. Dr. Johnson, do you have any thoughts on this?
Well, yeah, I do. I mean, I think it's important for us to continue down the pathway of selecting the next person in your position, and I was wondering, I couldn't find any. I noticed that we talked about before, or it had been mentioned in the paperwork before, that there was going to be a committee of 3 out of the total board members chosen. Is that part of the policy and procedure to only have 3, or could more be chosen from that? Or
no, there is. Good question. There is no policy on that procedure. That is what has happened in the past, and it was our intent today for the board to break into executive session once we move through our agenda. Mm-hmm. The board members then will review the top 5 candidates that I think Sandy did send to all of you. And then the board decides how many are on that interview committee and if they want to interview all 5 and when, and then Sandy will assist you in getting those arranged.
Okay.
So that's the thought.
Because
but we can't really break into executive session unless we have a quorum.
Well,
that's
no,
a challenge.
I understand that. Perhaps we should just give it a few more minutes, and she just sent her. Maybe someone else will be 5 or 10 minutes late as well. I mean, I'm not sure we should immediately make a decision in case somebody else comes on board, just to allow a little bit of time. That might be worth it, because a quorum is 4.
Yes, sir.
Okay. So if somebody else jumps on in the next 10 to 15 minutes, maybe we can do that, and then we'd have a quorum.
Doctor, what are your thoughts?
I would echo that sentiment.
Okay. Dr. Jameson, do you have any thoughts about the predicament that we're in?
I think the easiest answer is to just give it a few more minutes. So I would agree with Dr. Johnson on that one.
Okay, so why don't we wait until 12:45, and we'll kind of decide where we want to go from there. Is that acceptable?
Or 12:50.
Whatever works. That's fine.
Coming from somebody
And then,
very commonly late.
and then I would open it up to the staff. We could not have a meeting per se, but if you guys want to hear about frame shifting, I'm more than happy to deliver about a 20-minute lecture. But it's your call. I know the material. I could give it next time, or if you're interested, I don't know. I think it's germane material that anyone involved in healthcare needs to understand. This is significant material.
Now, Don, from the email that we'd received earlier, was this planning on being your last day? I don't remember when the last day was.
My last day of employment is May 24th.
Oh, May 24th. Okay.
That is
somehow I read that as March. So okay.
Yeah, that is the day after the budget hearing.
Okay.
Where county commissioners come together to vote on our FY25 budget.
Got it. Okay.
And when is the new chairman chosen? What day? What meeting?
The new chairman or the new director?
No,
the new chairman.
The new chairman.
That happens. That's our meeting in July.
So that's later in the summer.
That's correct.
So it's going to be kind of up in the air whether we get a director before a chairman or, I don't know.
Yeah, correct.
It's dicey.
Yeah, it'll be in July when both the chair and the vice chair are up for reelection on the board.
Okay.
My suggestion would be that, we not necessarily limit the number of people that are part of the selection committee, because, my immediate thought was on our last meeting, when we went through the survey results, and that's where the whole idea that I brought up before of the anonymous review is concerned, it might be good to have a fresh, set of eyes take a look at everything. In the sense, so it might be good rather than just having a few people involved to have the whole board or as many members want to be involved in that interview process, because it's an important transition. Obviously, the next person who takes that realm, and I think that it would be best for Panhandle Health District to have a lot of contribution into that decision-making process. So I obviously have a lot of respect for the chairman and the vice chairman and their years that they've put in here, but I think that at the same time, a fresh look might not be a bad idea as well.
Yeah, I don't know of any reason why our chair or vice chair would not welcome that thought.
Good.
Yeah.
Good.
I would echo that sentiment.
For sure.
It's my distinct sentiment that this is a insularly run organization, and it needs daylight. Daylight is a wonderful thing. Sunshine, vitamin D.
Were you able to reach out to any of the others or this morning, or you just kind of assumed that?
Well, we reached out to all of them originally, and some respond back that they will be here. Others we don't hear from necessarily.
Okay.
I'm very surprised Glenn's not here. I'm a little worried. He's usually very prompt about being here. Of course, we know about our chairman and his reason for not being here. Tracy from Shoshone County normally is here early, and I didn't see her here today. Tim Bertling did notify us that he would not be here.
Okay.
And so
So you had 2 or 3 surprises.
I am sure that this is the maximum that
Oh,
we will
really?
have. I would be very surprised if Tracy comes in late, but I'm agreeing with your thought. We'll give it a few more minutes just in case.
Anyone want to hear the talk? I mean, I don't know, raise your hand, not, I don't care. Would you want to get back to life?
Well, should we make it part of the meeting or not part of the meeting? In other words, if we,
I would just give it. I mean, it sounds like Don doesn't even want to call to order.
I'm thinking that if we could make the decision on whether or not we're going to have a meeting, that might be the next step, because if we're not going to have a meeting, then those who choose to stay can stay, and those who don't choose to stay.
That's fair enough. Well, I'm not seeing any expression on anyone's faces, so I'm thinking there's not much enthusiasm.
I would just say, I think we're here at the disposal of the board. It's absolutely. up to
And
you.
I am here for the disposal of you.
I would gladly listen to the presentation.
I would listen to the presentation, or you can save it for
The next time.
meeting
Yeah.
when it's an agenda item. So I'm completely neutral and really at your disposal as well.
Actually, I like the way you express that. Let's do hold off and make it part of the agenda. I like that. Thank you for making that observation. Okay, so we'll just wait
Okay.
on my part. What about your 360 review?
Well, I mean, that's an
That would be
action
the-
item that we can.
Yeah, we can't
pretty
really
much
cover.
move it until we have quorum. So I mean,
Yeah.
that's
Okay.
so
All right,
it's
well,
only a matter of minutes now.
Mhm.
And Sandy's been after me to fill out some paperwork, so I'm not sure if we can get that done today.
She's got you cornered today.
I did bring my card today, just to let you know. I thought you'd be happy to know that.
We can make you official.
Yeah, that's probably good.
It's warm in here today. It's warm.
Yeah, it is.
Yeah.
It's been a strange winter. Now, apparently next week it's
Winter again.
winter.
Yeah.
I know, it's crazy.
I'm kind of glad we're gonna go to Mount Vernon to see the tulip fields, which I didn't even know was a thing outside of like Holland.
It's what?
Mount Vernon, they have the huge flower farms there, so there are like hundreds, thousands of acres of just like tulips and daffodils
Wow.
and all these things. Like Holland has that,
Yeah.
but I didn't know the US did, so
No,
we're
I
gonna go
didn't
see
either.
that. But I kind of, this warm weather, you know, they're coming. I kind of need a little winter to slow them down a little bit before I get there.
Yeah, they're temperature sensitive. They're bulbs and then they come up when the trigger is just right.
Yeah, that's exactly right. But I'm not going till April 19th, so I needed to kind of slow, just hit the brakes a little bit.
Well, I'm hoping that we don't get a hard freeze. I have fruit trees
Yeah.
and they're all just beginning to bud.
Mhm.
Now, as long as they're kind of cocooned, they're insulated from bad weather. But if they start to expose themselves, the tender leaves are vulnerable to a freeze, a deep freeze anyway. So I've had years where I have no fruit because of that phenomenon.
All right, folks, I think we're going to make a decision to call the meeting. I don't think we'll be having it today. And we will move, we can't make any action on what I'm going to say, but
We can walk out of the room.
I do have that responsibility as the secretary.
All right.
So we will move all of these items, including hearing from Drs. Fletcher and Drs. Johnson, to our April 25th meeting. And I just want to apologize to you and you, Dr. Johnson and Dr. Jameson, and our guests for being here today. I apologize that we couldn't hold our Board of Health meeting today. And with that, I'll excuse you all.
All right, everyone have a good month.
Yeah, you too.
And at least we can get your paperwork done. So there is some level of accomplishment.
You know,
here,
it's
right?
not a total waste of trip.